OK, so we have flattened the curve. When it comes to infection rates and death rates, this country is the envy of the world at the moment. We've got our economy in an induced coma. What are we waiting for to lift those restrictions? That's the big question for National Cabinet tomorrow. I tried to find out earlier today from the South Australian Premier. Stephen Marshall, thanks for joining us. South Australia's borders are closed. You've had no infections of coronavirus for more than 2 weeks now. Why is there any need for any lockdown measures?
Well, we are going to be relieving some of those restrictions come next week. We already have the lowest level restrictions in the country, Chris. In fact, we didn't put anywhere near the directions in place that other states and territories put in place, yet we've had the highest level compliance. We've been really happy with it to date, and of course, come next week, we'll start to see those restrictions lift even further.
Well, what would those lifting of restrictions involve? Because as I understand it, you'll still have pubs and restaurants closed.
Pubs and restaurants are closed. They're not going to be opened up immediately, but we will be looking at that progressively over the coming weeks and months. What we will see next week, though, and Nicola Spurrier has been pretty keen for this, is regional travel. So our regions have been smashed, first of all with dry and drought conditions over much of the last sort of 3 or 4 years in South Australia. Then, of course, the devastating bushfires and now COVID-19. We're keen to see people from metropolitan Adelaide travelling around our region, spending money and creating jobs. I think that will be one of the first restrictions to be lifted.
How can they spend money and create jobs if they can't go to a restaurant or go to a pub? I mean, where are they going to go?
Oh, restaurants and cafes will be available for takeaway and, of course, accommodation, just getting out as well, spending money in the petrol stations and other conveniences. Tours are available, but we're not opening up hospitality just yet, but I don't think it'll be too far down the track.
You talk about your record, it's been enviable. You've kept schools open in the main throughout this as well. So in many ways, you're a great test case for the rest of the country. We're looking to you whether you can safely open up restaurants and pubs to show the way that the rest of the country surely can follow suit.
Yeah, look, you're right. We have led the way in terms of schools. We have about 10% of students studying from home at the moment. The rest are back at school, which is absolutely fantastic. And look, I think we can lead the way as well, but we've got to look at lifting those restrictions in a graduated way, not going from tight restrictions to no restrictions. And I think we've really done well in South Australia by listening to the public health advice. We've followed that very diligently. The advice is that we can start to lift those restrictions, and that's precisely what we'll do.
But these restrictions came in so suddenly right across the country. They just tossed people out of the work by the hundreds of thousands. They've shut down businesses. And yet you have a situation now where your borders are closed off, they're quarantined off, you have no infections for over 2 weeks, you've built up your hospital capacity, you've built up your testing capacity. So what is the justification really for not opening up everything as soon as possible? Because you must know that every day a business is shut is another day when people's livelihoods are in jeopardy.
Absolutely, and that's why we haven't had some of the restrictions, the punishing restrictions that have been in other jurisdictions. We've had very low levels of community transmission in South Australia. We've done particularly well over the last couple of weeks. But the people of South Australia don't want to go backwards. We're very keen, and business are telling us that they don't want to have this sawtooth arrangement where restrictions are lifted only to be put back on a couple of weeks later. We'd rather do this right the first time. We've only got one shot at this. And I think that a lot of people were expecting that we'd be at a COVID normal scenario by the end of September. I think now people are saying that's going to come months earlier. And that's because we have done this in a sensible, evidence-based way. And we'll just stick to implementing the advice that we have received. It's put us in very good stead in South Australia. We haven't had the punishing restrictions of other jurisdictions. And now South Australians are starting to reap the rewards of their good compliance with the restrictions that are in place.
But if you've shut your pub or lost your job from the shut pub or the restaurant, then it's a very punishing regime. It's very hard for some of us to comprehend what we're trying to do here. Of course there's going to be coronavirus infections, but we've got the capacity to deal with them now, and yet even in a state where there's 2 weeks of no infections, we've still got businesses shut.
Yeah, that's correct, Chris. You've just restated the position, but I can't be any clearer. In South Australia, we never went down to the two-person gathering limit that we've seen in other states and territories. We've had it at 10, and we want to see that progressively lift. And soon we'll get to a position where it will be viable for restaurants, pubs and cafes to open. But the clear advice from the public health officials is not just yet.
Yeah, well, those numbers of 10 for a public gathering, 10 people could visit Mum on Mother's Day, that's certainly something that people around the rest of the country would envy. But you're looking at getting the AFL competition up and running soon, and South Australia's got a big role in that. I hear that you're not going to allow visiting teams to fly into Adelaide to play their games. What would be the problem with that?
Well, again, it's not up to me. We're not making political decisions or ideological decisions in South Australia. We're leaving it up to the public health officials who have got us to this position that we're in at the moment and that we're all enjoying here in South Australia. And a lot of it is going to depend on when contact sport and competition is allowed to resume. Now, depending on when that occurs and depending on where other states are in terms of their if you like, their infection rates, especially if they come from community transmission, we will then be in a better position to make up our mind whether or not teams from interstate will be coming into Adelaide, or whether at the first part of the season our teams travel out for those games and have essentially away games for the first part of the season.
It seems to me that many of the state premiers have changed their interpretation of what we're trying to do in this country. The idea was to slow the spread of coronavirus, make sure our medical system, our health systems could deal with any infections. We had the capacity to do that, to build up our testing regimes and the lot. We're not looking now to try and have COVID-free states, are we? Some sort of unrealistic expectation of keeping the virus completely out of some states.
Well, I don't know whether you followed the National Cabinet minutes, but it was pretty clear about 2 or 3 weeks ago. We did make a decision when we looked at the 3 different options: elimination, suppression or control. That we were going for the suppression model, and that's what we've been very clear on ever since. The Prime Minister said that the National Cabinet would put a framework to the people of South Australia. It was due for next Friday. It's been brought forward to this Friday because we have been doing particularly well. But it's still a very nasty disease, Chris. I mean, you look at the UK, they've lost 30,000 people in the last month. So we can't take this disease for granted. We've lost nearly 100 people around the country. We've done well, but we've got to stay the course.
Yeah, but you're sticking with suppression, not eradication.
Yeah, well, I think some jurisdictions are getting closer and closer to elimination. We've just got to make sure that we don't allow this disease to get away from us anywhere in Australia. The sooner we get on top of this, the sooner we can open up all of the borders in Australia, the sooner we can get back to a more normal environment in this country. Now, I don't think we'll be getting to any mass gatherings like a game at Adelaide Oval between the Crows and the Power, a showdown, if you like, of 55,000 people anytime soon. But we are going to be making these steps back to a more normal environment, and particularly an environment that's going to promote as many jobs as we can possibly muster.
Let's hope so, as soon as possible. People are really hurting. Thanks so much for joining us, Stephen.
Thanks, Chris.